almost a third of British households share their home with a cat. And for the team at the Grove Vets, the day begins with a rather special feline patient.
Morning.
Good morning. Oh, here he is, our favourite boy.
So who is this?
This is Frank, so mine and Andy's cat.
The vet's cat.
Yep.
Lovely.
Handing the reins over to James today because we're too anxious to treat our own cat.
Oh,
Good
he's
boy.
lovely.
Gorgeous.
He is a good boy.
So what's the problem?
He needs a bit of dental work. He's got a full lesion on one of his teeth and we moved house at the beginning of September, so he's had a bit of a run-in with a few of the other neighbourhood cats. He just managed to chip one of his canine teeth.
These are things that you could be doing yourself.
Well, we do check him at home, which is obviously how we noticed these, but he's a bit of a pickle to handle at home. We joke that if we had CCTV in the house, nobody would ever believe that we were both vets because he runs rings around us.
I'm very honoured that you're handing the reins over for Mr. Frank, 'cause I know how much he means to you as well. You can just see this little tooth here, which is sort of almost disintegrated away, and that should be a full tooth there that's sitting sort of proud of the gum line. Oh yeah, I can see there. That's the lesion, isn't it?
What does the lesion mean?
Basically, there's two types. There's one type where the crown dissolves away and the root dissolves. And there's another type where the root stays intact and then the crown sort of fractures off. The only way to know if the root is there or not is on an X-ray. And then we'll be able to tell what type of treatment he needs on those teeth.
He's insured.
Who's insured with?
He's insured with Petplan.
Okay.
I used to have a ginger boy too. He was called Wally, and he was a bit of a Wally.
Consent given?
Time to do some work.
Over to you.
Thank you.
Hey Frank, are you okay, kid? Yeah, absolutely fine.
Okay, good boy.
Once Frank is sedated, James gives him the anaesthetic.
Great. Are we happy?
Yes.
Whilst people, however unwillingly, will keep their mouths open for dental procedures, animals must be anaesthetised.
You really like the dental
I do like
work.
it, yeah, I enjoy dental work. I just think it makes such a huge difference to our pets, because it's like, it's like us, if you have toothache,
You don't want to
it feels so rubbish. The majority of people actually don't even check their pet's teeth.
Oh, how awful.
Well,
Note to
Fern,
self.
you've got my number now if you ever need to have a quick chat. Right, let's go. Are we ready? Good.
So this is the scraper.
This scrapes away the calculus without damaging the tooth surface. So now we need to turn over.
All right.
Oh, that's interesting.
What's
Do you
happening?
see this tiny spot there on the inside of that tooth? Shows me that that's an early resorptive lesion. So that tooth is very likely going to go the same way as the other one.
Cat dental lesions, a very common and non-preventable condition known as feline tooth resorption, occur when cells begin to attack healthy teeth. In Frank's case, it looks as though the crowns have already started dissolving, but X-rays will show if there are roots which need removing as well.
So I do have to get a little bit dressed up for this. This is where I put my Saturday night outfit on. Oh, there we go. Okay.
This is marvellous.
So this is where we need everybody to stand back 2 meters. X-rays.
James and Amy are having a look at the X-rays now. From what I kind of glean is that Frank is in for 3 or 4 procedures.
So this is the tooth that we know there's the spot that we found on the inside. And we can see here that the roots have totally dissolved away. So I'm going to just use the drill just to take this crown off, and then we'll go up to below the gum line.
What can I hold for you?
If you'd be able to, that would be great.
It's going quite deep, isn't it? But you have to get it below.
If you just get it below the gum line, because then the gum
skin,
just heals over.
You'll be out of pain, but will he still be able to eat and mouse and have fun?
Absolutely. I think it's one of those things where sometimes what we see is almost the opposite, where those sorts of behaviours actually increase once they've had dental treatment done.
Because they feel so much better.
Because they're so much better.
Part of the daily round is seeing pets who come in with recurring conditions which need careful, continuing care from the vet team.
Who's this? this?
So this is little Cleo.
Little Cleo?
This will keep quite a big Cleo.
And that's exactly the case today with 3-year-old Rhodesian Ridgeback, Cleo.
So why is she here?
So she's here because she struggles with her skin. So we've managed her skin for a little while. Typically, it's actually looking a lot better than it has done.
This is like a sort of eczema or?
So we suspect an allergy. So we've taken some bloods this morning to test for some environmental allergies.
And what would be the most common allergy?
So a tree pollen or another plant pollen, and sometimes dust mites. We do see some food allergies as well, but they're less frequent.
Despite the fact that Cleo's skin is looking better at the moment, it hasn't been an easy road. She's been really suffering with hives, itching, and sore, painful lesions that have proved hard to manage with medication. So it's a whole team effort to try to get to the bottom of what might be triggering these flare-ups.
We're going to check everywhere, take the opportunity to have a really good look in her ears, at her paws. She's also got a little lesion on her tail, which I think is probably not...
Oh, there's a wee coming. I'll hold it there.
Well,
Yeah. Oh, no, yeah, oh, yeah, there we go.
Got a poo as well.
Oh, I can catch both
Just
if I'm
everything.
lucky. I've had children, I understand.
All part and parcel of the job.
Well, you're welcome. Carry on. Yes,
So she's got this little lesion on her tail, which I think is probably worsened by her skin just being quite reactive, but actually the lesion on her tail was initially caused by her being so excitable with her tail and whacking into table legs, chair legs.
Diagnostic tests are an important part of treating issues like allergies, but costs can add up. Thankfully, these are usually covered by pet insurance.
We take a swab of each ear and a little skin scrape here.
Student nurse Ella is performing these sampling techniques under Amy's watchful eye.
Between her toes and her feet. I noticed she's got a
several
little...
sites you're choosing
Yeah,
there.
we'll try lots, because her lesions are very generalised, so we want to get a good representative.
Oh, that's the special forensic.
Yes, forensic tape strips. Technically, it's called an acetate strip. So we're just picking up everything that's sitting on the surface of her skin. So bacteria and yeast and the cells and the hair. Allergies can cause the skin to be really inflamed, but then inflamed skin is much more likely to become infected. So I suspect that's what's happened with Cleo here on her tummy. So we want to find out what bacteria is causing that and which antibiotics would be effective against those bacteria.
By taking a sample just beneath the skin's surface, it's possible to check for fungal infections and parasites.
So you've done the scrapings, you've done the forensic sellotape, you've done the swabbing, and now we're doing something more intrusive.
Yes, these are skin biopsies. So we use this little biopsy tool. It's like a punch biopsy. So this is incredibly sharp.
A biopsy is a fairly routine step when vets are investigating more complex or persistent conditions like Cleo's.
The outside sharp circle is cutting right into the flesh.
Yeah. So that's it in there. Pull this out. Ooh. Wow. That's a core. So it's got all of the skin, all of the layers of the skin.
And some fur too.
Yeah, should hopefully give us an answer, or at least rule out a lot of things. I'm going to put it in a little formalin pot. Could you label that as a right chest?
What are you going to do now?
Suture up the little hole.
All right.
So it's just one little cruciate stitch. We'll send all of those off to the lab and they'll be looked at really comprehensively, and we should get some answers along with the blood samples.
Well, let's hope so, absolutely.
Yeah,
She's been such a good girl.
She has, she's been great.
It's been 9 days since Amy and Andy's beloved ginger cat, Frank, underwent dental surgery to remove several teeth. But his recovery hasn't gone quite to plan, and today there are growing concerns that something may not be right.
Frank, obviously he had his dental, and he was all right for a couple of days after his anaesthetic. Then he had a night where he vomited multiple times through the night, and we were like, this isn't right. We took some bloods, and then we were pretty gutted to see that he was suffering with what we call an acute kidney injury. Essentially, the kidneys have taken a bit of a kicking from the anaesthetic, from the pain-relieving drugs. They all kind of combined. It's quite rare. Unfortunately, my cat is one of those statistics.
weeks after Frank's dental treatment, his kidney function has improved, but is still below where it should be.
Frank was hit a bit harder and his kidney injury was more severe than we ever really pick up. It was a big shock, especially because he's a young cat, so he's only 6. Are you gonna come out?
Regular blood tests will monitor how Frank's kidneys are doing. He's potentially going to need medication from now on to help support his kidney function.
I think his case probably just emphasises what it's like to be the other side of the consulting table. Remembering what it's like for owners having to, that kind of anxiety and that worry over what's going to happen to your pet is hard to deal with and cope with. So it has been a good reminder that, yeah, we have to be compassionate to our owners too.
Okay, be brave. Be brave.
Fern Britton Inside the Vet, brought to you by Petplan.